Hello, as promised in today's episode I will talk about lymphedema after breast cancer surgery. We will briefly discuss the mechanism of upper limb edema after breast cancer surgery. I will show you exercises, massage techniques and other tips to deal with this problem. My name is Kate, I'm a physiotherapist and welcome to my channel. First, we need to know why the swelling occurs at all after breast removal surgery. Each of us has a lymphatic system, which is a part of our immune system. It consists of a network of lymphatic vessels, lymph nodes, lymphatic organs, and lymphoid tissues. The most important function of the lymphatic system is protection against infections and circulation of body fluids. If we look at the chest, there is also a network of vessels and lymph nodes in the area of the breast and the armpit. When the tumor tissue covers not only the breast but also the lymph nodes, it must be completely removed. Therefore, in many cases, breast removal surgery is connected with dissection of the lymph nodes in the armpit area. These lymph nodes are responsible for draining lymph from our arm. If they are removed, then the lymph flow is restricted and it accumulates in our arm, creating a swelling. And of course, not every operation results in lymphedema. According to various studies, the occurrence of swelling after breast cancer surgery ranges from 5 to 10%. Swelling of the hand is a huge problem. Hand looks bad. There is a problem with putting on clothes, rings, there is pain, burning, the skin on the hand becomes shiny. Very characteristic is a slow return after compression. If you press your fingers tightly against the skin for a few seconds, you will see dimples in the skin when you lift your hands away. And now, treatment. First of all, if you notice a swelling in your hand after breast surgery, please consult your doctor as soon as possible because untreated lymphedema can lead to many serious complications. Therefore, it is really important to introduce treatment and physiotherapy as soon as possible. Exercises after breast cancer surgery should be performed slowly and without pain. They should last only a few minutes and you can repeat them several times during the day. Sit down with your hand raised. If you do not have a wedge, you can put it on the pillows. It is important that the hand is above the heart. Start by squeezing your hands slowly. Do 5 repetitions. Now slowly flex your elbow 5 times. Then put your hand up and shake it. Now put your hand forward and hold for 5 seconds. Then bring your arm to the side and hold for another 5 seconds. Now put your hand up and hold. Make 5 elbow bends. Now squeeze your hand 5 times. Shake. Stand against the wall. Place your hand on the wall at the height of your heart. Start slowly climbing your fingers up the wall. Do 5 repetitions. After the last repetition, keep your hand up and shake. You can do 2 or 3 sets of these exercises at one time, but what is important is not to overload the muscles. So if you feel a distinct muscle fatigue, take it easy. It is better to do these exercises more often during the day than to do everything at once and overload. Now let's move on to massage. It will be a self-massage, so you can perform it at home. There are a few rules we need to remember about. We massage with the whole hand. We always start from the distal part towards the heart. We use very slow pushing movements, and what is the most important is that we cannot overheat the tissue, because overheating the tissue may increase the swelling. That is why it's recommended not to use any lubricants like olive oil or massage creams or heating creams. And the massage should only last up to few minutes. And of course you can do it several times during the day, but it shouldn't be long. For the purpose of this movie, I am wearing a top, but at home it's best to stay naked. So let's say I am after right breast cancer surgery and my right hand is swollen. Remember what I told you about the lymph nodes resection from the armpit. We cannot push the lymph from our arm towards the armpit because there are no lymph nodes over there. That is why we will use three alternative directions. The first will be the axillary lymph nodes on the opposite side to the operated side. So our movement will start at this part of the elbow, on the upper side of the arm, through the sternum, and end in the armpit area on the other side. The next direction will be the scapula on the operated side. We also start the movement from the elbow, on the upper side of the arm, and end on the scapula on the same side. The third direction will be the pelvic lymph nodes on the operated side. Our movement will start in the back of the elbow, through the back of the arm, the side of the chest towards the groin. Summing up, we will drain the lymph towards three directions: towards the opposite armpit, towards the scapula on the operated side, and towards the groin on the operated side. So let's go to the massage. With circular movements, activate the nodes in the area of the sternum. In the area of the opposite armpit, and in the groin area on the operated side. Sit down comfortable and place your hand on the wedge or pillow. Begin with the first movement from the elbow to the opposite armpit. Work with your whole hand very slowly. Make 5 such movements. Now the movement towards the scapula. Also do 5 repetitions. Then move towards the groin, perform 5 repetitions. Now make 10 circular movements around the elbow band to activate lymph nodes in this area. Then make 5 movements from the wrist to the elbow bend area. Turn the hand over and perform another 5 repetitions. Turn your hand again and rub the wrist area with circular movements. Make 5 slow movements from the palm towards the wrist. Massage each finger several times. Again, make 5 movements towards the wrist. Go back to the elbow again. 5 times with your hand like that. Five times with your hand turned. Finally, make movements in 3 directions you already know. The first, from the elbow to the opposite armpit 5 times. The second, from elbow to shoulder blade, also 5 times. And last, from elbow to groin, also 5 times. And that is all. I always recommend my patients to use a measure tape to check the circumferences, and really try it yourself. Check your circumferences, perform those simple exercises, perform the massage, and recheck. And I am more than sure that you will notice that your swelling is reduced. Very often after a massage, it is recommended to use special compression cuffs, but I will not talk much about them today because it is a very individual matter. Your doctor or physical therapist will certainly advise you on this issue. Okay, at the end I would like to tell you a few simple rules that you should know when it comes to lymphedema after breast cancer surgery. What you shouldn't do with your hand on the operated side is lifting and carrying heavy objects, performing the same repeatable movements, slipping on it, overheating it, compressing it by, for example, measuring blood pressure, wearing tight clothes, rings, etc., taking blood and giving injections. What you should do is high positioning of the upper limb during sleep or rest, regular wearing of breast prosthesis because it improves your body posture, regular measurements of the upper limb circumferences on both sides, exercise a few times a day, self-massage also a few times a day, and use compressive stockings if recommended by your ND or PT. That will be all. I hope you found this video useful. Thanks for watching and see you next time.